Hi, welcome back to my channel. So in this video, I'll be covering the diagnostic procedures in endo and recent advances. So I've just made a PDF of some questions and like the most important ones only. So we'll just brush up through the thing. And so on percussion, when we get a dull note, it basically represents an abscess, and when it is a sharp note, it represents an inflammation, and when it is a metallic note, it represents the ankylosis. So then bite test devices are frag finder and tooth slot. All right, so if you think about it, so tooth slot, something like that, with a single O. So it's just like something like a blue thing, and there you have like this, and then there's a point, right? Then coming on to the three types of cracks. So they are split tooth, fracture, graze lines. Okay, now pain on biting is apical periodontitis. And if there is pain on release of biting force, it is cracked tooth syndrome. Temperature of GP, that is gutta percha, for heat test is 65.5 degrees Celsius. Mechanism of action of heat test theory, it is Van Hessel theory. And for cold test, it is just give me a second, it is Brainstorm theory. Important thing to note here is that in case of heat test, you do it for less than 5 seconds, but cold test is done for less than 15 seconds. All right, so site of for the EPT of anterior teeth and posterior teeth. In anterior teeth, we usually take it at incisal third, and then posterior teeth we take it at middle third or the mesiobuccal cusp. Then electrolyte used is Profi paste or Profi paste or a toothpaste. Now let's just talk about the false negative and false positive. So in anxious patient, we get a false positive. In pre-medicated individual with narcotics, alcohol or tranquilizers, we get false negative. In liquefaction necrosis, it's again false positive. In recently traumatized tooth, it will come as false negative. In multi-rooted, it will come as false positive, as it might have it might be partially necrosed. All right, in that case. Then metallic restoration or contact with the gingiva, so it can be false positive. Then recently erupted tooth with immature apex will give us false negative. Then calcification, again false negative. Now anesthetic technique. So first of all, we can use intraligamentary. All right, and then if it does not like pass through, then we can use interpulpal, and last call is inferior alveolar nerve block. In test cavity, the speed should be high with water coolant. All right, then coming on to stains for fracture. So in this we can use methylene blue, we can also use iodine, and we can use dye with zinc oxide eugenol. Rate of blood flow method is through laser Doppler flowmetry. The principle is Doppler principle. Oxygen concentration is pulse oximetry, and the thing is about Beer principle is Beer-Lambert law. This is related to the intensity is indirectly proportional to distance traveled. All right, then light used with the wavelength in the is we use red and infrared. So infrared, so wavelength is 660 and 940 nanometer. Oxygen changes in capillary bed rather than the supply. So see, when we talk about the rate of blood flow, we are taking about the laser Doppler flowmetry. Then if it is a capillary bed, so we are basically talking about dual wave spectrophotometry, and the wavelength is like 760 to 850 nanometer. So detection of blood flow within the pulp by passing light through the teeth, it is a plethysmography. All right, then Which teeth reform faster after cooling, vital or non-vital? Vital. Williams' technique of using liquid crystal showing different colors or at different temperatures is liquid crystal, something like test, differential color test, something like that. Now referred pain is because of the C fibers, I guess. I'll just confirm it. Myelinated fibers are A fibers, A delta, and larger diameter is also A delta. More conduction velocity is also A delta. Fibers more resistant to hypoxic is C fibers. Fibers are responsible for pain occurring during instrumentation, again C fibers. Fibers which respond even in degenerating pulpa, C fibers. TOP positive in an endodontically treated tooth is suggestive of eccentric contacts. Then radiographic technique used in endo is a long cone paralleling technique, and we basically utilize the RIN XCP instrument for taking. Then loss of bone undetected till how much percentage? So it is 6.6%. Then bone fill healing occurs in 6 months. CBCT resolution voxel size is 0.2 to 0.4. We will prefer 0.2. Most ideal test is basically cold test plus EPT both. Test used in full coverage crowns is dry carbon dioxide. Significant pocket with the absence of periodontal disease. Significant pocket with the absence is suggestive of vertical fracture. Their nerves extending up to microns from pulp into dentinal tubules is 150 to 200 microns, which is more innervated. So cusp tip or cervical region, so it's cusp tip. Zone of wheel lies in the cell free zone. Now you should know the sequence also. So it's like odontoblastic zone, then we have cell free zone, then we have cell rich zone, and then we have the central zone. How many nerve endings exist at the dentine border? So it's like 15K to 20K. Alright, so this is just like a one-liners only, and in another video I'll be covering other ones. So if you found this video helpful and if you liked it, do subscribe to my channel, give it a like, share, subscribe, comment. Yeah.